from Croaky here at the National Nursing Forum in Hobart, and I have here two of the presenters from the previous session we've been at, Odette and Mel. Would you be able to introduce yourselves, please?
I'm Melissa Carey. I'm from Ngāti Raukawa descent, Ngāti Huri descent from New Zealand, and I'm the nursing program coordinator of the nursing program.
Thank you.
I'm Odette Best. I am a Wakuin clan member of the Goreng Goreng Nation. Bontamora line in me as well from my grandfather, and my father is Kumanberry Yugambeh through adoption. I'm a professor of nursing at the University of Southern Queensland on the Ipswich campus.
Fantastic. Now, you've both presented about a case study on cultural safety that will, one would think, have implications nationally. Can you talk about that?
Absolutely.
Who'd like to go first?
So we decided to explore how we were as a school in terms of preparing to develop and deliver on the mandated curriculum around cultural safety. What we wanted to do was just to determine where we were at and how we could get the best possible outcomes to meeting those standards, because we weren't really sure what was needed to get to that point. So that's what we presented on today, with some findings from that case study research.
There were some very interesting findings, Odette, yeah?
Yes, there was some interesting findings. USQ has got an incredibly strong history of delivering Indigenous health content as a standalone core course within their undergraduate nursing curriculum, and that was something that I developed way back in 2002. So it wasn't very surprising for us as the research team to find that some of those comments were really strong about how well we teach Indigenous health. What we did find particularly interesting, though, was the responses around cultural safety, and the fact that there was a really large percentage of our findings that said that cultural safety should be taught by Aboriginal and Torres Strait Islander people, that it was about Aboriginal and Torres Strait Islander people, and when we saw those findings, that for us meant that cultural safety gets reduced or seen only as ethnicity, and we know that that is just not the case, and that's not how Irrahapi Ramsden intended for the whole notion and the whole model of cultural safety to be perceived as.
Can you tell us what's problematic about that?
Yes. Would you like to do that, Melissa, or do you want me to?
So the thing that becomes problematic is that we keep othering other cultures instead of embracing the notion that we all have a culture and we all work from a cultural background. And I think as nurses, it's really important that we have that understanding of we're all working from a context of knowledge and understanding that is based on how we were raised and the culture that we grew up in. And I think if we keep pushing it to Aboriginal and Torres Strait Islander academics, then we continue to other people in that way. So that becomes problematic when we're caring for our patients.
Absolutely. And it's also, I think, that notion that non-Indigenous people or white people don't have a culture. And the bottom line is our medical model here in Australia and our medical dominance is very much a white cultured response around healthcare. That is not the development from Indigenous people about how health gets constructed or rolled out or delivered within this country. And so when you don't see yourself, white people, as having a culture, it becomes really problematic for culturally safe healthcare in this country, because white people do have cultures, but sometimes in a context or a colonial context like Australia, it's really problematic for white people to actually identify that they do have cultures, because being Australian is not an ethnicity unless you are Aboriginal. So when we say Australian, it's like, well, what actually does that mean?
And you said that we do have this great definition of cultural safety, but it's under challenge. Can you talk about that?
Yes, I can talk from the AHPRA Australian experience. Several months ago, AHPRA, our registration body here in Australia, that is basically the registration body of all the health professions in the country, actually sent out for consultation. Can we define cultural safety? And people at USQ, Melissa, myself, and a number of our colleagues were absolutely distraught that AHPRA would actually want to be sending out a consultation round on defining cultural safety. And what I liken it to is like if you watch an apple fall from a tree, it's called gravity, and that's what happens. So Irrahabadi Ramsden actually created and defined this incredibly beautiful model around care for all people called cultural safety, and yet it hasn't actually been picked up within an Australian context as what a definition of cultural safety actually is, and it needs to be. We have a definition. It happens to be an Indigenous knowledge, but Irrahabadi really defined beautifully what is culture, that all people are culture bearers, and that all of our culture can actually impact upon the care that we give our patients. We've got a defined model, we've got a definition, and that needs to be endorsed as the definition of cultural safety in this country.
And where are we now with that?
I'll throw that one over to you, Melissa.
Well, we are waiting for new standards to be released, nursing standards and accreditation standards, particularly talking from a program perspective. So I think we'll know a little more when they're released about where we are. But in terms of teaching cultural safety and having it embedded within curriculum, I think we're a long way from getting to where we need to be in Australia.
Absolutely.
And there's a lot of work to be done. And I think that's what our research really highlighted for us,
Yes.
that we have a big job ahead of us, even with
Yes.
our own school, and we have a lot of work to do nationally.
And so where can you take that nationally, with that research that you've done? What will you do with that now?
Well, currently, and after obviously the conference, we'll be writing up a publication about that with our other team member who was part of that research team. So we'll be writing a publication about that. And then hopefully the new standards will come out. And then it's, I think, a time for all schools of nursing in the country to actually start to think tank around how they're actually going to do this, because I have genuine concerns with the new standards dropping about Aboriginal health and Torres health and cultural safety. And I don't think currently our schools of nursing and midwifery are prepared.
And what should they do?
Oh, lots of things actually. They should employ more Aboriginal academics and Torres Strait Islander academics to actually teach that specialty, because Indigenous health in this country is a specialty, doesn't get recognised as one, but it needs to. And for cultural safety, I'll throw that over to Mel.
Well, what we found was that our academics were really looking for some support, some team teaching with experts, and some education for their own professional development, so they felt prepared to actually teach this content well and to take it on. I think most of them were prepared, given if they had that support and that education. So I think that's a really positive thing for us that we would take forward, definitely.
Fantastic. Anything else either of you would like to say, both of you would like to say?
I just think we're at a really unique time in nursing and midwifery history, and I'm really hoping that we actually can step up to the plate on this one and that we can actually get it right. Because if we don't get it right now, it's going to be, I dare say, problematic for a really incredibly long time. And can we just be purists when it comes to teaching cultural safety? So hashtag Irrahabadi Ramsden. NNF 2019.
But I can see that one happening. That's great.
Hashtag Irrahabadi Ramsden.
That's great.
No, just thank you very much for giving us this opportunity and listening to what we have to say.
Pleasure.
Really appreciate it.
Thank you,
Thank you
Mari.
so much for doing it. I'll just switch you off now.